Welcome to this essential guide brought to you by the American Hernia Society, the worldwide authority on hernia surgery. Our mission is to unite expert hernia surgical leaders from around the globe to advance the science and treatment of hernia. Together, we're here to support you every step of the way. In this video, we'll share the top 10 things you need to do before hernia surgery, designed to optimize your surgery and enhance your recovery.
Preparing for your hernia surgery can feel overwhelming, but we're here to make it easier for you. By following these 10 tips, you can ensure you're in the best possible shape for your procedure and recovery. Let's dive right in.
Number 1, good nutrition. In the weeks preceding your surgery, try to be mindful of eating a balanced diet with a focus on proteins such as meat, beans, dairy, eggs, and fiber. If you have special dietary needs due to health conditions such as diabetes, make sure you comply with these dietary instructions.
Number 2, work with your surgeon, primary care provider, or other medical professionals to optimize your health condition to minimize the risk of surgical complications. This includes taking medication as instructed, smoking cessation, and ensuring your blood sugar is within desired range if you are diabetic. This can take weeks or months, so be prepared for additional doctor visits.
Number 3, review the instructions provided by your surgeon and anesthesia providers. Learn when and where you need to show up on the day of your surgery. Learn when to stop eating and drinking before your procedure. Review any medication instructions, such as when to stop your blood thinners or diabetic medications if you're instructed to do so.
Number 4, get a good night's sleep. Depending on the time your surgery is scheduled, you might be asked to come to the hospital very early on the day of your surgery. Plan at least 2 nights in advance and try not to leave things to the last minute.
Number 5, general hygiene. Take a shower or a bath before coming to the hospital. Clean out your belly button and remove any lint that might be stuck there. Do not shave the surgical field yourself. Your surgical team will perform any necessary shaving the day of surgery to reduce the risk of skin infection.
Number 6, transportation and support for postoperative care. It is not safe to drive after anesthesia. If you're having outpatient surgery, plan to have someone drive you home after your procedure. Anticipate you'll have some degree of pain and tiredness for a few days after the procedure. You might need help with activities of daily living at home as well. Be sure to enlist help for household responsibilities you normally manage, at least for the first few days after surgery.
Number 7, wear comfortable clothes. Pack some personal belongings if you're staying in the hospital for a few days. You'll be asked to change into medical gown once you're at the hospital. Hospitals usually provide non-slip socks, disposable personal care items such as toothbrush, toothpaste, shaving cream, or razors. However, if you prefer to use your own personal items, don't forget to pack them with you. If you're bringing a phone or tablets, don't forget the chargers.
Number 8, avoid wearing rings, watches, and chains. If possible, remove any piercing before coming to the hospital. Consider leaving your valuables at home. Most hospitals provide safe storage of essential valuable belongings such as phones or hearing aids.
Number 9, come to the hospital accompanied by someone close. Have a friend or family member accompany you. Many hospitals require that someone stays with you overnight if you're having surgery, so please plan accordingly.
Number 10, plan to be off work. Depending on the surgery and the type of job you do, you might not be able to work for a few days to weeks after your hernia surgery. Make sure you discuss this with your surgeon and employer. Ask your employer about opportunities for light duty and about any forms that are needed to be completed. If your surgeon needs to fill out some forms, give your surgeon ample time to complete them. Don't plan to hand over the forms to your surgeon during your clinic visit if you need them to be completed promptly.
By following these tips, you will help prepare for your hernia surgery and on a path of a smooth recovery. Remember, these tips are here to guide you, but always follow the specific advice of your healthcare provider. The contents of this video do not reflect medical advice and are the opinions of individual members with the American Hernia Society. For more information and additional resources to support your hernia surgery journey, please visit our website www.americanherniasociety.org.